welcome everybody. Today we'll be focusing on learning a little bit about working with interpreters and going over some general guidelines for clinical settings. A little bit about me. Dr. Karina Muro, or Karina. I am part of the early psychosis program clinics. I'm a clinical psychologist. So I have experience in providing clinical care in both Spanish and English, as well as working in interpreters in a community mental health setting. So a lot of this training is really tailored to those experiences, as well as, best practices in clinical care for working with interpreters. I'm also faculty here in the department and the director of clinical training for our programs at UC Davis, EDAPT Clinic. I hope that some of you or most of you were able to quickly glance over some of the preferred readings before this training that really sets the tone for some of the nuances that we might discuss regarding language and cultural considerations for working with interpreters. If you did not have some time, that is totally okay. I will make some references to some of the reading material in the training. But I definitely encourage you to block 30 minutes aside after this training, maybe next week. Today's Friday, but just 30 minutes to glance over the do's and don'ts guidelines and the cultural formulation interview. It really is geared towards thinking about considerations for various languages and working with clients and families from different backgrounds from ourselves. And sometimes, it's helpful to have a guide with questions and sort of a quick tool to reference. So please take a look at those if you haven't done so. So what are we hoping to learn today? We'll go over best practices of working with interpreters in early psychosis care. We'll have some time to talk about what are the elements that are needed in a pre-meeting and during the meeting with an interpreter, and also after working with an interpreter in a session or an appointment. And what are those key concepts that you want to think about for a debrief session with working with an interpreter? We'll also have a little bit of time to talk about some specific clinical considerations for risk assessments or telephone interpreting, and allow some time for a Q&A and just really be able to answer some questions or discuss any past experiences that you may have had that could be helpful for us to revisit as we learn the guidelines and best practices for working with interpreters. But before we dive in, I think we need to take a moment to pause and reflect on the diversity of our nation and really the diverse populations that we work with in clinical care. As you can see here, 19% identify as Latinx. That's actually the second largest racial and ethnic group in the US. Actually, the Census Bureau, this is from the Census Bureau data, and in September 2022, they did a survey, sort of a current population survey, and they learned that 47.9 million foreign-born immigrants reside in the US, both whether undocumented or documented. And this is really the largest ever number recorded in a US government survey. So clearly, we are often working with clients and families and delivering clinical care with clients and families that come from various backgrounds and underrepresented and marginalized communities. And so really, this is the landscape that we are sitting in. Some of you may know, we often don't have many bilingual, bicultural providers in various threshold languages. And so this is why we're dedicating this space to think through what are the best practices for when we need to work with an interpreter with a different language than ours, and what are some considerations that we should have. So we are going to have some time for questions and answers at the end, but I do want to hear from those that are here. What has been your experience when working with an interpreter? what has gone well? What have you found to be whether challenging or complex? And why? Or what are some skills that you have taken from your experiences of working with interpreters?
I can share one of my first experiences with an interpreter.
Thank you.
I was a intern therapist and we didn't have a Spanish speaking clinician, and I had an English speaking first or second grader and a Spanish speaking mom. And I had an interpreter from one of the school resources that was there that had worked with mom before. And what I found, and I had been trained in how to use an interpreter, but what I found was that there was a whole lot more conversation going on in Spanish. And I speak intermediate Spanish, but so I knew that there was more conversation besides just the volume of what was shared between what I said and what was interpreted, and then what mom said and what was interpreted back to me. So that was just one of those kind of frustrating and confusing and kind of like, wonder what I'm missing here. Pieces that I think is important to keep in mind when you're using an interpreter, that it needs to be a direct interpretation.
Yeah, thank you for that. And I think unfortunately we hear about certain situations similar to yours quite often, where sometimes the dynamic may change, or the interpreter may have these sort of sidebar conversations with the client, and the provider's sort of just wondering, what am I missing? What's happening? And that's tough to navigate, definitely. And hopefully at the end, we can come back to this and think about what could be some possible strategies to navigate those situations.
I have a comment on that. So I remember that when I first started working with interpreters, it was a little difficult to actually maintain the eye contact or look at them or with the client while I was speaking. And I know that we need to do that instead of going like through the interpreter, like, oh, tell them this. That was really difficult for me to learn in the beginning.
Mm-hmm. And it's challenging, right? I think cognitively, you're trying to lead the session, but also there's a new person in the session, the interpreter, but maintaining that eye contact with our clients and families, definitely.
I see one more response in the chat here from James Gaylor. They say, similar experience. Some interpreters will begin asking their own questions before checking in with me. I know a lot gets lost in those lengthy responses.
Thank you for that. And so, yes, I think as we go over some of the key components for working with interpreters, I think there are some strategies to try to implement to help alleviate some of this sort of complexity that can come about. Well, thank you all. It's very helpful, because I think these are key points that we're going to go over in the next couple of slides. But before we do that, a little interaction time. We're going to spend 10 minutes going over a video that has a really nice model of the best practices that we'll discuss. As we watch this video, I really ask you to think about, what are those do's? What are the things that we do want to keep doing when we're working with interpreters? And what are those things that we should be mindful of to help alleviate some of the challenges or complexities when there's someone new and also unknown in the room? And I know that this can look differently in different clinics, so keep that in mind as well. I think we hope that these are elements that can be structured, but I know that sometimes depending on the clinic and how you go about booking an interpreter and things like that could be challenging. But let's watch this video. Let's keep in mind those challenges that folks brought up, and also things that are going well.
ኣብ ባዕዳ ሃገር ምምፃእ ብጣዕሚ ከቢድ እዩ ብዝተፈላለየ ምኽንያት ዘይትፈልጦ ባህሊ ዘይትፈልጦ ህዝቢ ከምኡ ከዓ ዘይትፈልጦ ቋንቋ ኣብ ከምኡ ምስ ትርከብ ብጣዕሚ ይከብደካ ከም ኣብ ፀልማት ኮንካ ትነብር ዘለካ ኮይኑ እዩ ዝስማዓካ
If you have a non-English speaking client, they have as much right to access services if they're living in this country as anyone else. And so it may be important to have an interpreter to enable that to happen. And as well as having an interpreter, ideally one should have a trained and qualified interpreter who's gone through training about what interpreting involves and also will have signed an ethical code of conduct and will be very clear about things like confidentiality.
ንዝኾነ ሽግረይ ክገልጽ እንከለኹ ብምልክታት ጥራይ ይገልጽ ነይረ ቋንቋ ስለ ዘይክእል ከምኡ ከዓኒ ናይ ጭንቀት ሕማም ስለ ዝነበረኒ ምስ ሓኪመይ ክረዳዳ ኣይክእልን ነይረ ብጣዕሚ ከዓ ይጭነቕን ይሳቀይን ነይረ
Occasionally, particularly if people don't know many people who are fluent in English, they may bring a child who is very fluent in both languages, and that's really not appropriate to use a child ever as an interpreter. To think about matching where possible for gender, for example, particularly if it's a case of a sexual assault, it's particularly important, but it's generally worth trying to match for gender anyway. Also, one might want to match for age, possibly in an ideal world for religion.
I came across a case whereby I was in the home office helping someone to explain the situation, why they are here. And the interpreter was from another country, Europe, Poland. And the asylum seekers was from Congo. But they're both speaking French. Now, the Polish man is speaking French using his own mother tongue kind of understanding. The Congolese is expecting this man to understand what he is saying.
There's likely to be a number of sessions, consultations with the client. It's really important that the same interpreter is booked throughout. A pre-meeting would be a kind of briefing meeting where what you're doing is explaining the context in which you're going to work, which often mental health professionals assume everyone is familiar with, but not everyone works daily in psychiatry or something else. So it's important to talk about the context, to talk about the nature of the meeting. For example, if it's going to be an issue which is going to have particularly serious implications, like it could be an assessment under the Mental Health Act or issues relating to children going into care.
If the trust is not there, then you'll get wrong information and you'll take decision on wrong information, which will not help the client.
To establish the trust, it's very important to be clear throughout the session that the clinician holds clinical responsibility, that the interpreter is merely doing their job and interpreting and is not discussing anything else. In terms of the seating for a session, which is very important, my personal view is that a triangle works best because then everybody can see everyone else. It's very important that there are some ground rules that are made clear for everyone at the beginning, which is normally that everything is said will be interpreted. It's very important that the interpreter and the clinician agree in advance that there will be a slow and steady pace of communication.
I take things step by step. Even when you are talking, I have to stop you in order for me to have time to tell the client what you want. And it's also for me to take the decision to stop the client when they're saying a long sentence, I have to stop them to give me a chance to translate to you what he just said so that the communication is flowing properly.
I would expect an interpreter to carry the vocal expression and also possibly to mirror any kind of non-verbal if it was appropriate, because a good interpreter is actually acting as the person's voice. My personal view is that interpretation should be done in the first person, I, particularly if it's in a mental health or psychotherapeutic setting.
Myself, I tend to become everything now. If I'm in front of a psychologist trying to deal with a client, then I have to do my best to understand the language the psychologist speaks in a way to explain it better to the client. Some of the words you found there, they are really technical to the mental health field.
Different cultures may present same kind of feelings in very different ways, so just to be very mindful of that. I think once the session has ended, it's very important that you spend a bit of time, maybe 5 to 10 or longer if it's required, time with the interpreter.
Working as a professional interpreter is challenging. Helping these people to explain their own stories that they went through back home, whether it be through torture or through different means. It is hard. So sometimes you put yourself in their place.
You do have a duty of care to your interpreter. They're often interpreting in very, very traumatic situations and are as much, if actually not more, susceptible to secondary or vicarious traumatization as the clinician, in that they haven't had a thorough training in mental health. And also to use their expertise if there were any particular issues that came up in the session that possibly had language or cultural relevance that you had not quite understood.
ሕጂ ግን ብጣዕሚ ሕጉስቲ እየ ምክንያቱ ኢንተርፕረተር ዝትርጉመለይ ቋንቋ ብናተይ ተረዲኡ እቲ ዝብሎ ቋንቋ ንሓኪም ሕማመይ ሽግረይ ክገልጸለይ ክገልጽ ስለ ዝኽኣልኩ ክሕከም ከዓ ብትኽክል ክኢለ ስለዚ ኣብ ዝተመሓየሸ ሂወት ከዓ ይነብር ኣለኹ ኣነ እውን ቋንቋ እንዳኽኣልኩ ምስ ህዝቢ እንዳተለማመድኩ ጽቡቕ ናብራ ክነብር ጀሚረ
Thank you all for your attention and watching this video. I know it looks a little outdated, but it's one of the best, I think, that captures some of the elements that we are going to go over. Any impressions? Any thoughts on what went well or anything that stood out to you of the best practices? Or any elements of this video that affirmed sort of your method of working with an interpreter and how you're structuring those sessions?
So I see Destiny in the chat saying it stood out to me that an interpreter should use the same intonation of voice and maybe even hand gestures as the client.
Mm-hmm. Yes, best practices. And I know for most settings, actually, and especially for medical settings, interpreters go through a certification process and there are guidelines that they abide by. And for most of them, there are certain guidelines that guide them in terms of best practices. And that could be, right, modeling some of the intonation, in other instances, it could be the interpreter sitting behind the person or the client using the service to really kind of help minimize some of the nuances that can happen.
Hello, I'm Lilia Garza. I work
Hello.
for, hi, I'm in Colusa, well, our department, Behavioral Health in Colusa. And I really like the triangle setting
Mm-hmm.
that you get to see. We are visual people as well as, so we get to see when we're talking and interpreting to the therapist or the doctor and the client.
Yes. Thank you.
That's also a form of communication.
Right. The nonverbals and the way we're sitting in the room. Exactly. And something that I wanted to highlight, I know for individuals that may be using sign language interpreting, it actually would, it is helpful for the sign language interpreter and the clinician to sort of sit side by side so the client can also be able to see both the sign language interpreter and the provider, which is a little different. Something that unfortunately, because of time, we won't be able to spend too much time here, but in the additional reading materials that I have recommended, there are some more best practices for right when working with sign language interpreters, which does change some of those practices as well. Yeah, thank you for highlighting that.
I see another comment from Kayla in the chat that says, I also like the idea of a pre-meeting to talk with the interpreter and explain the details of the session or what might come up. Secondary trauma for the interpreter is really interesting to me too.
Thank you. Yes. So, and that's a nice segue to those elements that we're going to break down of the importance of the pre-meeting and also the debrief meeting, which allows for more collaboration with the interpreter. And, although we as clinicians, we're working with the clients and families and we're serving them, I think ethically, we are called to really think of how does this collaboration also affect interpreters in terms of their time or vicarious trauma, right? If they are having to join a difficult session, which I encourage you to bring up in your supervision spaces and consultation spaces as well, as those situations can vary depending on situation. Thank you for that. I think that's a nice segue to our next point. So really, let's define interpretation. Interpretation consists of interpreting meaning as clearly as possible. Now, I think some of the challenges that do happen when we're working with interpreters is that sometimes, depending on the challenge, right, we may notice that perhaps words are not directly being interpreted, or there are cultural nuances that perhaps don't have a direct translation. So think about that. I want you to keep that in mind as we're talking about interpretation, because I think it's not just what are these key elements about working with interpreters, but it's also what is our cultural conceptualization of the language needs of the family, the language, the culture, what we know about their background, what we still need to know, and what additional consultations we need to seek out to better serve our clients and families. So that is the end goal, and it does become complex and very nuanced. Here are two different definitions of simultaneous versus consecutive interpreting. Often in clinical spaces, you will see the consecutive interpreting, which is someone saying something in the first language, and then there being a pause, and then the interpreter translating that, interpreting that in the second language or in the language being served. And just a friendly reminder that when we are referring to translation or translation services, actually that's relating to written text. So translating something in the written format. So how should this look like? What is the best way to approach this? Actually, there's not one sole accepted way or structure, but there are these best practices that we all should ideally abide by and try our best to make happen in our appointments. These are guidelines that are across the board from APA to the British Psychological Association to the Australian Psychological Association. They actually have some really nice guidelines, and they've done some really nice work to support clinicians in settings when working with diverse populations, Indigenous populations as well. And so a lot of this work really comes from that research and that effort. Actually, a lot of what we'll be going over today from the British Psych Association and the Australian Psych Association, they have some really nice manuals that are available in reference at the end. But really, we want to spend some time with a pre-meeting, so a meeting before your appointment, a debrief meeting, and a meeting at the end. I think the biggest challenge for providers is often, where do I find this time? And so I think that is where this clinical practice, and again, sort of our ethical duty, thinking about that these sessions will take longer. And so trying to work around how can you go about your schedule to ensure that you're having this pre-meeting and debrief meeting with interpreters, and seeking additional consultation and supervision if this is a challenge in your current setting. What does this pre-meeting look like? So we really, the best practice is to try to have 10 to 15 minutes in this pre-meeting. If it is your first time working with an interpreter, I highly encourage you to think about, would you need 20 minutes, or if this is an interpreter that you've been working with and have some rapport and consistency, then perhaps you're going to adjust accordingly and it might be 10 minutes or so. But this meeting is so crucial to be able to, one, introduce yourself, introduce your setting. As we work with early psychosis care populations, oftentimes our terminology in psychosis can be very complex, and perhaps there may be no word that identifies psychosis in a specific language or culture. And so those are the conversations that you want to be able to have in this pre-meeting. Perhaps you want to go over some handouts. If you're doing a psychoeducation session, for example, perhaps you're going over the stress vulnerability model, or perhaps you're going to talk about depression or anxiety or trauma. You want to be able to prepare the interpreter about what information you're going to provide. Perhaps it means having extra handouts, and of course, best practices and at all possible is seeing if you also have these handouts translated in that language that you're providing, so that all parties involved can be prepared. The interpreter can feel like they have an idea of what topic will be covered as much as possible, and that the interpreter can ask questions to you regarding, any terminology or regarding how you want to be seated in the session. For example, I know someone brought up this idea of it's very helpful to have a triad location. So these are the logistics that you can discuss in a pre-meeting. I think also it could be helpful to have this pre-meeting and talk about logistics in terms of timing and how you might ask them to stop if the session is going very quickly, or you're noticing something, or there's an observation of some sidebar conversations. In this pre-meeting, you can create a little problem-solving solution game to make sure that they know if they need a pause, or if you need to check in with them during the session. And I think this is where during the meeting, all of this is now happening in real time, and there are many dynamics now at play. So again, you still want to take the time to ensure that the client and family hopefully are aware that there will be an interpreter. Ideally, the family feels comfortable with this, and if not, we will talk about some strategies about this. But oftentimes, I think, unfortunately, what I do see is that there's not enough prep time, or there hasn't been a conversation with client and families about their concerns about working with an interpreter. So those are also things you want to do beforehand so that when you have your session or appointment, these pre-conversations have taken place and the family knows who's going to be there, and then you can have the introductions. Confidentiality concerns and trust is a valid concern. Interpreters are required to maintain confidentiality, but I think for us as providers, it is on us to try our best to create a safe, trusting environment where clients and families can ask questions if they have concerns about the interpretation process or the interpreter. Perhaps it means that you need a session to talk about their past experiences of working with an interpreter if these concerns come up, or what has been challenging for them in the past. This is definitely a very valid concern for minoritized clients. And so it may be that we need to take our time to really explain how confidentiality looks like and remind them that interpreters still have to abide by confidentiality policies under HIPAA as well. And I think a common concern that often comes up for clients and families that may come from a small ethnic minority as well is this concern of, well, how will my confidentiality be protected? What if they know they're part of my community or, part of my outside community? Will they know my identity? And so exploring some of those concerns if this is coming up. And if that is the case, actually, I do bring this up in another section, but you may consider telephone interpreting in that situation, where perhaps there could be more of an anonymous way to help protect confidentiality if these are valid concerns from a small ethnic minority group. Speaking directly to the patient, so when we're sitting in a room with an interpreter, remembering to try to keep that eye contact. Someone brought this up in the beginning when we watched the video. And as much as possible, keeping that connection with the client and family. And these are things as well that you can bring up in your debrief session with the interpreter if you're needing feedback. And being aware of the speed and the pace that you're providing information. Perhaps it may mean that you'll need to break the information more into smaller chunks. And typically, what I have seen to be more successful is if you're planning for a session as you would sort of typically do for an English speaking family, if English is your primary language, you may think of breaking that session into 2 to 3 sessions if you are working with an interpreter. That will take longer, and there needs to be room for this pre-meeting and debrief meeting. So the agenda might, the course of those sessions might look a little different. If there are concerns about whether the client and family are understanding the interpreter, I know that this has been, again, I think some of these challenges that often clinicians and providers bring up is sometimes the family still looks confused, or I can tell that things are being lost. This is a nice strategy, the teach back method. So having then the client or family repeat back, and I should say, I keep saying the word family. I want to pause and just acknowledge that chosen family or support persons for the client, but whoever's there with the client as well, they can actually repeat back the information for you, and then the interpreter should be interpreting that to you as well. And that's a nice way to kind of double check on comprehension and making sure that everyone is taking the information as they should. And it might help you to then revisit to plan your sessions if needed, if you're noticing that there is more confusion. So I've kind of echoed this a little bit, remembering to speak in shorter sessions. Again, I think this is really nice to think about your pre-meeting with the interpreter. You may want to have a signal with them or make sure that they can give you feedback if you're concerned about when you should pause. Sometimes that can be a little tricky. Being able to stay away from sort of these complex analogies, perhaps. If you are someone that likes to use metaphors or analogies, just be mindful of that approach when working with an interpreter. Thinking about cultural backgrounds, not all metaphors and analogies might interpret the same way. So you want to be clear and sort of simple and concrete in your messaging and trying to prioritize those key points as much as possible. And making sure that you're bringing up one point at a time. I think that is the best way to ensure that the clients that we serve are understanding and taking in the information. I think this is particularly important when we're thinking about diagnosis, assessment feedback, or psychoeducation, or, you know, this is the first time where the clients are listening to new information. And again, making sure that at the end you have this additional debrief time. It is crucial to be able to have this debrief time to go over any concerns. So what does this debrief time look like? You may want to bring up questions to the interpreter about any concerns that you had. So one of the examples that someone shared in the beginning was sidebar conversations or other comments being made where perhaps the provider is unaware of. And so this would be a good time to bring up these concerns to the interpreter to check in. And, you know, although they should be going through their own training as an interpreters and abiding by their own guidelines, this could be something where you can really clarify your role as a clinician and why it's important that everything is being interpreted. You may want to follow up on nonverbal communications or gestures that you noticed. Interpreters often can act as cultural brokers or cultural consultants. And so this is a really good time if you felt that you were confused or you missed something, they might be able to bring some insights into some cultural considerations for you as a clinician to keep in mind and to think about for your case formulation and thinking through the needs of the client. And also, you know, if you have any opportunity to find out if they are able to continue working with you, I think one of the ideal practices, which is very challenging at a, you know, in practice and at a systems level, is to try to have the same interpreter each time, especially if this is a client that you're going to be working with long term. It'd be really nice to be able to build that rapport with the interpreter and really join them as part of your team for just a smoother process of working with the interpreter. That is definitely the best clinical practice. And sometimes it is possible. I have had that experience. Again, depending on language needs and sort of what is going on at the time, it may not always be possible, but that is certainly what we should be trying to strive for. So I might go quickly because I want to make sure we have some minutes at the end for questions and answers. As I mentioned at the beginning, please take a look at the cultural formulation interview. The pre-meeting, during meeting, and debrief meeting will definitely be much more richer if you have a better understanding of your client's background in terms of their identified culture and acculturation as well, right? And also, as we know, there are various levels of English proficiencies for clients. And so English language proficiency. So this may be a topic that you want to spend more time into and thinking about and checking in to see what are the pieces that you may be missing. I think this comes in handy when there are families and clients who may be hesitant about working with interpreters, and you can really dive into what are those past experiences. And the cultural formulation does have some nice questions to support you in those conversations. As I mentioned, there are, if those of you who have used telephone interpreting, it's challenging. You don't get the nonverbals. You ideally want the face-to-face contact. But I think the positive side here would be when there are confidentiality concerns for small ethnic groups, or perhaps when there are, if Zoom is not an option, there are transportation barriers or digital barriers, then perhaps you may need to rely on telephone. Or if it's a brief consultation. I think there are some benefits of telephone interpreting, but best practices, of course, is face-to-face, and there is good research and evidence to support telehealth interpreting. So before, if it is your first time working with an interpreter via Zoom, I encourage you to revisit telehealth guidelines in general. They apply sort of these concepts of a pre-meeting and a debrief meeting are still crucial for telephone or telehealth, and I would still recommend these as best practices regardless of the modem of your appointment. And I think as a helpful reminder, via telehealth, we are able to use a chat function, for example. Perhaps there is some positives in using Zoom for clients that may want to use nonverbal messaging to communicate that they are understanding. And so there are many ways that you can use telehealth to your advantage. I think another quick example I can think of would be perhaps in your pre-meeting, you agree with the interpreter, I will send you a private chat if I need to pause or if I have a concern. And that could be a very private way to communicate with the interpreter while you're in Zoom that normally we wouldn't have in face-to-face. So that's just one small example of the benefits of interpreting via telehealth. And lastly, but not least, of course, is often this theme of how does this look like in risk and safety planning? And this is why the pre-meeting is so important with your interpreter. If you already have a plan that you're going to do an assessment or some sort of risk assessment, even more so, more important to make sure you have that extra time with the interpreter to go over, this is how my session might look like. I may have to create a safety plan. I think for some friendly reminders, it's good to know that the National Suicide Prevention Lifeline, for example, does provide these crisis services in different languages. And so you may want to have that ready to go and prepare the interpreter as well, that you're going to need them to help you relay this information. Again, I think this really highlights the importance of this pre-meeting to be able to talk about these things. And of course, sometimes this is not something that we can necessarily prepare for, but it's definitely helpful to have that in mind and to prepare for that in a meeting if you are working with an interpreter. And if you're not prepared for that because it's unexpected, more important to have this debrief meeting, right? To go over what went well, and anything that you may need to debrief with them if you have to do a risk or safety plan assessment. I'm going to pause here. The last of the slide are our references. Here you can find more detailed examples. We are going to send specifically the working with interpreters in health settings guidelines for psychologists from the British Psychological Society. That I think is a really nice short 20-page review of the concepts we went over today. But I want to make sure I have time to answer any questions or thoughts, or if there's a specific comment or question as we went over these different practices.
I just had one thought that came up, and that is because we are, I'm sure a lot of counties are short on Spanish-speaking clinicians.
Mhm.
And when a Spanish-speaking clinician goes out on leave, or we have turnover, that kind of thing,
Yeah.
we may at times need to rely on a language line.
Mhm.
And I'm just curious what others' experiences have been, or tips and tricks on using that, because like you said, there's a whole lot that makes it more complex when you just have somebody on the phone that you haven't known in the past.
Mhm.
And you may not have the same person available the next time you have a session.
Yeah. And could you add for the language line, is that still part of your clinical setting, or it's sort of a outside service?
It's
the
a
language
contracted
line?
service.
Contracted service. In that case, I would definitely recommend, and please correct me if you have done this already. If they're able to have this like additional 10-minute time before this service is starting, to make sure that you have a pre-conversation, because I think you're right. I did say I have worked with the same interpreter for some cases, but that was such a unique situation. It's not like I've had that privilege. It's a privilege to have that. And I think I go back to, you need that extra time in the beginning to prep and make sure you're on the same page, and you can kind of prep them for what your session's going to look like.
That's good. Thank you.
Yeah. And so really a key is, I think often we say, oh, I have a 3 o'clock session from 3 to 4. I'm going to book the interpreter from 3 to 4. And actually, no, we have to get into this practice of saying from 2:45 to 4:15,
Mhm.
right? But it's like this like cognitive shift, because we're so used to, I do this all the time. I book my calendar for an hour. But no, this really means you need the 2:45 to 4:15 in case anything happens in between as well.
Yep.
Or in case a challenge comes up. And so this idea of, I think the time piece, it sounds so simple, but it's so difficult to put into practice, I think. Yeah.
It's hard to remember when you're trying to fit a bunch of stuff into your schedule and just trying to put it on there, but it's helpful to reiterate it.
Yes, I think you can avoid some of the unexpected challenges that can come, not all of them, but I think you might feel more prepared for it. And then I think the interpreters appreciate this level of collaboration, because then they feel also more confident in terms of what they're walking into. Again, they have their own training and certification process. But in the video, we really heard from the interpreter just like how helpful and useful it is for them to know, and to be able to join the providers. And I hope this probably goes without saying, this is definitely in the do's and don'ts guidelines, but I ideally really, our clients and families deserve to have an interpreter when they don't speak the primary language of English, and really exploring why they may not want to work with an interpreter, if they're really trying to have a family member, for example, to interpret, or I think those scenarios come often. So we need to take the time to explore that, and really try to get to a place where we can help them see the benefits of interpretation and acknowledge the challenges. It's a dialectic. I think it's both. I know it's not always perfect, but ethically, I think that's what our clients deserve, to get the best care in their language.